Absolutely. So,
That's okay. In pharmacology and drug discovery. And then I'll touch briefly on our into UEA, where that we provide an international foundation in pharmacy, health and life sciences so that you can access these degree programs. So first we've done a little bit of an introduction. So then we're going to talk about what a pharmacist is and the pharmacy degree at UEA. We'll have a brief talk about what pharmacology is. So then I can introduce what our pharmacology and drug discovery degree is, and then a little bit of talk of careers. And hopefully we have time for a few questions at the end. So our School of Pharmacy. I think the next slide is a few facts on this. Okay.
만나는 게 아니라 이 사람 만나다 보니 이 사람이 이상형이 됐던 경우도
그런 경우가 많지.
그 사람 만나면서 이상형이 뭔가 난 그 사람이야라고 그 사람을 떠올리면서 이상형을 말을 하는 거.
그 다음부터는 주로 누구 얘기했어?
박혜진, 김수현, 공유, 서강준.
그렇게 많으면
I meet you. Yeah, I meet you.
Thank you. Thank you. So the MPharm degree is a 4-year degree, and that's accredited by, in the UK, the General Pharmaceutical Council, and we call them the GPHC. And this means that your degree is allows you to be a professional pharmacist practicing within the UK and some other countries. Okay, our School of Pharmacy, MPharm, is in the top 15 for pharmacology and pharmacy by the Complete University Guide 2024. And we are currently the only pharmacy school in the east of England, which means that all of our students get to do placements in our local area. Our graduates do go on to work or study more or less straight away. This says 90% of graduates, but actually, historically, in the last couple of years, probably 98% of our graduates on our MPharm get exactly the placement they want for their first, it's called your foundation year training, and that's where you become registered as a pharmacist in the UK. We have some lovely facilities. This photograph on the top right is taken within our teaching laboratory that's called New Science, and this building is a really, really fabulous facility for carrying out undergraduate science and research. And we have this process at the bottom here that's talking about Oriel. So this is your placement year with the GPHC to get your registration documents to be a registered pharmacist. So pharmacists are the medicines experts. They are principally a health professional, so it's a patient-facing career you're signing up to as a pharmacist. And it really is the person who links that healthcare science with chemistry, okay, with the chemical sciences. So their job is legally to ensure that drugs are safely and effectively used amongst the general population. Okay, that is the general role of a pharmacist. So I guess I usually ask this question: what sciences do you think are involved in pharmacy? What do you think? I want you to have a quick think about that. What science you think are involved in pharmacy, and then I'll go through these on my next slide. Okay. Somebody's maybe talking.
I think all of them. I'm not sure about the
yeah,
but yeah.
Okay, so in pharmacy, we look at using biology, so how medicines work within the body. We use chemistry, so how do you make medicines? We actually use quite a lot of physics that some people are very surprised about, but this is important for the properties of medicines, not just how those medicines move throughout the body and how long they stay in the body, but also how stable those medicines are, how long they can be kept on a shelf, how long they can be kept in a solution available for people to buy in a shop, over at what temperature, things like how they're stored. But also sociology and psychology is used quite a bit, so how patients behave, because as a patient-facing career option, it's very important that you are aware of how people work okay, and how people are expect to be interacted with.
May I introduce that in Korean very quickly?
So where does a pharmacist work? So pharmacists work in...
May I explain the previous page to audience in Korean very quickly? Yeah, this one. Yeah, may I interpret it in Korean to our audience?
Yeah, please do. Yes.
지금 교수님이 말씀하신 거는 이제 생물이랑 화학이랑 물리 그리고 사회학 이게 약학에 있어서 다 중요하다라고 말씀을 하시는데 아까 이제 이전의 프레젠테이션에서 화학이 제일 중요하다라고 아마 저희 직원분께서 설명을 해주셨을 거예요. 근데 그거는 이제 입학 요건에 필요한 거고 어쨌든 들어가게 되시면은 물리적인 사고라던가 화학적인 사고, 생물적인 사고, 사회학 이런 게 다 필요해요. 왜냐면 바이올로지 같은 경우에는 이제 메디슨, 약이 사람 몸에 정말 어떻게 작용을 하는지에 대해서 이해도가 필요하니까 바이올로적인 지식이 필요하고 케미스트리 같은 경우에는 이제 약을 만들 때 어떤 성분으로 만들어야 되는지 연구를 해야 되니까 화학적 지식이 필요하고 물리 같은 경우, 피직스 같은 경우는 필요 없지 않나라고 생각할 수 있는데 이제 약 같은 거를 이제 그 모형을 만들 때 이 약이 얼마나 사람 몸에서 머물 수 있는지 이런 걸 계산을 해야 되다 보니까 물리적인 지식도 필요하고 소시올로지 같은 경우에는 이제 환자의 기분이라던가 상태에 따라서 이제 약을 처방을 해야 되니까 사람에 대해서 파악을 빨리 하는 것도 좀 약사로서 필요한 자질이다 이렇게 설명을 하고 계십니다. Yeah, you can go ahead. Sorry for interrupting me.
No problem. Okay, so where does a pharmacist work? So quite a lot of people in the UK, I don't know about in Korea, but think of a pharmacist only as somebody who works in the community, somebody who works in a pharmacy where you go and collect your prescription. But actually pharmacists don't just work in community pharmacies, they work all over. And these are just a few areas that pharmacists work. So we see them working in a hospital where a pharmacist is a key person in the care of patients. So they help doctors to figure out exactly how to carefully generate a patient's care plan. They work in the community, obviously, dealing with people's everyday care and health. They also work directly with doctors. So they work as primary care. So they work in GP surgeries. They also work in old people's homes, care homes, the elderly and the young. But they also work in industry. So it's possible to get jobs that have a career trajectory within industry. There are also a whole spectrum of other career options available for pharmacists, either in research, but also within things like the armed forces, or special placements for pharmacists. So any job area where they have to have care of a group of people. So within the army or the navy, they have to have a pharmacist on their medical team. It's really, really useful if you're interested in what and where a pharmacist could work. It gives a couple of background stories to different jobs and pharmacy careers. And this is on the NHS Pharmacy Careers website. So I think if you're interested in a career in pharmacy in the UK, then please do take a look at this website. And on the website, each area is a link where you can then go into a story that tells you about somebody's job and role as a pharmacist. So to qualify as a pharmacist across the UK, there are currently 32 accredited courses. This is a 4-year full-time degree programme that gives you a master's in pharmacy. And at the end of that 4 years, you do a 1-year foundation training. This is a bit like in medicine, how they have a pre-registration year. So you work as a trainee pharmacist, you're paid in this position, but at the end of that placement, you have to sit the GPHC registration examination, okay, in order to fully qualify. And this whole process, the 5-year process, has to be achieved in 8 years. That's something that the GPHC dictate, okay? So I guess I just want you to have a quick think about what it takes to be a medicines expert. So I want you to think about what you would do. Put yourself into this position where if a patient came into your pharmacy and they were very visibly upset, they were crying, and they said to you that they've just been started on an inhaler, so a blue inhaler, bottom right here, for their asthma, but they can't get it to work. What would you do? And this is an important question if you're considering being a pharmacist, because one of the important things is that you're aware that you need to interact with people. This career is something that's very important about dealing with people and thinking and empathizing with how a person feels. Okay, so what would you do? So in pharmacy, the GPHC, they have this wheel. You see a very nice coloured wheel in the centre here. And these are the beliefs that a pharmacist in the UK who follows the guidelines of the GPHC, they must have every single one of these 9 behaviours in order to be an effective and safe pharmacist. And so in answering that problem, what would you do with this patient? You need to have number 1 at the top be a person-centered care. So we need to take that person who's upset into a quiet area and explain to them that it's okay, that you will help them and walk them through how to use the inhaler and what the appropriate way to take their inhaler is. And that person shouldn't be leaving your care, the pharmacy, until they feel reassured that they know how to use their inhaler and manage their own health. Okay, so it's about using your professional judgment, being a professional in your behavior, using your professional knowledge and skills to effectively communicate how to use the inhaler. You might need to bring in a colleague because you might need to work with somebody else to make sure the rest of the pharmacy is working well at the time. And you're going to obviously respect this person's confidentiality and privacy. Okay, so all of these behaviours are what a pharmacist applies every single day in the job that they do. So I'm going to switch gears slightly now and talk very briefly about what is pharmacology. So sometimes people don't really know the difference between pharmacology and pharmacy. But pharmacology is the science that explains how medicines work. Okay, and it involves the study of how medicines are processed within the body. It's crucial for discovering new medicines. Okay, and the way that it does this is by identifying new strategies for fighting diseases.
이제 아까는 약대 관련된 설명이었고 지금은 파마콜로지라고 해서 약리학 관련해서 설명을 하시고 있는 거예요. 그래서 약리학 같은 경우에는 이제 약대랑 가장 다른 점은 약이 어떻게 작용을 하는지, 그리고 제일 중요한 거는 신약 개발 이런 거 관련해서 이제 연구를 하는 학문이라고 설명을 해주셨습니다. Yeah, I'm done.
Thank you. Okay, so a pharmacist works directly with patients, but a pharmacologist is a scientist. So that's a scientific role, and they work usually in some kind of laboratory and researches new drugs. There's also a role called a clinical pharmacologist, and they work in the hospital, applying that science of medicine to real human scenarios. So there is an area in the middle which is merged between the two. Okay, so our pharmacist that we've already touched on this morning is a licensed health professional who prepares, dispenses and advises on drugs. Whereas a pharmacologist is the person who researches and creates those new drugs. So what sciences are in pharmacology and drug discovery? So it's probably quite obvious that we have chemistry because we need to make medicines. So here is a very basic synthetic scheme. You might even get to do this reaction in your chemistry lessons at school, where we are making aspirin, a common pain relief medicine, from salicylic acid and acetic anhydride. So this is an acid catalyzed esterification reaction. Okay, so chemistry is involved. Biology is involved, how medicines work. And so in the consideration of this, we have to think about what barriers to medicines getting in the body there are. So in the stomach, you might be aware that we have a very acidic environment. So any medicine that is taken orally, we need to think very carefully about how it's going to interact with a very acidic environment in the stomach. Replacement. Is there something that we can change in the way the medicine is structured to make a specific change in the body to treat a condition? How do our medicines turn on or off processes in the body, or do they actually control and kill viruses that are around of their own accord? So there's lots and lots of different aspects of biology involved in pharmacology. So where do pharmacologists work? Once you've done your BSc, you might want to do a master's or a PhD program. And these are quite common. Quite a lot of our students stay within the school and do a master's by research and then move on to PhDs. And a PhD position in the UK is a paid position. So you get paid to do a PhD within this area. And so that's an option that's available. Pharmacologists can work in things like the sales and marketing of drugs. They can go on to do other courses to be an attorney, so to work on the law side of drugs. They can work in areas even as seemingly random on TV and films advisors. They can work for the press, so as journalists and in publishing. They can teach in academia. Probably the majority of them go into industry to work as research scientists actually developing drugs and medications, or they might want to do what we call in the UK PGCE and do a qualification to become a teacher afterwards. It depends what interests you most when you are undertaking your degree. So this scheme in orange on the left hand side is talking about how long and the process for making a drug. And so I've put this on here because each area, each step of this process requires a different kind of job, a different position in these different roles. And there are areas that a pharmacologist can work within each of these areas. So there are over 60 course providers in the UK for pharmacology degrees. Ours is a 3-year BSc. Others do maybe a 4-year MSci, some with integrated placements. And in pink at the bottom is highlighted what we call our degree programme. It's a degree in pharmacology and drug discovery. We call it this because we have a strong component of medicinal chemistry. So we do focus on the chemistry side, and we have research projects available in drug discovery or working on natural products with the medicinal chemists within our school. And that's not necessarily something that's available in other providers. Our campus is nestled within a hive of research activity. So UEA is belonging in this research consortium. So these are all on the research side, the other side of campus. And this is just a whole host of different research areas that go on within the schools at the university. And so,
sorry,
yeah.
Yeah, you can go ahead. Sorry.
Yep. For 2024, we have there's some tuition fee information here, but this is information that I'm sure will be shared with you from my colleague. The tuition fees, and you can find this information online. And we also have a scholarship for undergraduates. But in order to get onto our courses, you'd be probably interested in entry requirements. So we require AAB at A level for the pharmacy degree, including chemistry or one other science, or an interbaccalaureate, or we also run our Into program. So there is no direct entry to undergraduate programs, but you're probably aware of this with qualifications from South Korean high schools. So Into UEA runs the International Foundation in Pharmacy, Health and Life Sciences. And this means that you can progress to UEA for, if you successfully go through the Into program, onto one of our degree programs. Okay, and this is a really fantastic place to work and live on campus. And I do encourage you to have a look at the website and do some research into this for yourself. And this is the aerial view of campus. You can see all the sports facilities, and Into is housed here. So it's right in the middle of campus. The School of Pharmacy is here on the top left, and you can see the lake as well. It's really a beautiful place to work and live. There's lots of different support available at UEA, and I'm going to very quickly flick through these because I'm aware that we are running out of time. But there's lots of opportunities for you to speak to people for support in terms of your well-being, your studying and things like that. There's lots of opportunities on campus to do fun things, meet new people. We have a dog. This is Duffy, who's their student support dog. You can go and pet a dog on certain days of the week. This is a view from the other side of the lake on campus. And as I said, it really is a beautiful place to work and live. And lots of our students do report about how safe and secure they feel, how lovely a place it is to be. There are lots of clubs and societies for you to join. Lots of people doing interesting things to enrich their days. This is the swimming pool on campus in a sports park. We have a climbing wall. And I briefly talked about employability, but lots of our graduates go on to have very successful careers. We are a top 20 UK university for job prospects. And we have a very good support system with the Grad Centre and the Career Central, where you can go and you have mentorship. And I send my students here quite a bit, and I talk to this within the School of Pharmacy to make sure that our students are thinking about their career the whole way through their undergraduate programme. Okay, so you can go and you can practice for interviews, you can have to talk to somebody about your career options or applications that you're taking place. And this is about the different ways you can speak to advisors in Career Central. Some additional resources, if you want to do your own research, please do have a look online at the Royal Pharmaceutical Society, look at the NHS Careers website. We also have talks and webinars about UEA that would be advertised in other places. And so please do reach out if you've got any other questions. So that's the end of my slides. If you've got any questions for me, I've got a minute or two I can take those.
So actually, one of the questions many students ask is whether there is a high dropout rate at UK Pharmacy University. So is the actual academic difficulty level manageable for an international student?
I'm not aware of I don't know the actual statistics on that, but my recollection from our school is that we actually have a very good retention and progression rate. Over COVID, this dropped slightly. I don't want to say any numbers because I don't know, but for example, usually our year in total is around 100 students, and over COVID we had 1 year that dropped to 80 students by the time they were in the 4th year. But this is very unusual. Usually we carry 98% of the students, you would expect more or less everybody to continue. Sometimes people have a break in studies, so they might repeat the year because of personal circumstances, but the majority of students progress through our degree program.
제가 방금 물어본 거는 저희 학생분들이 많이 물어보시는 것 중에 하나가 이제 약대가 진학률이 굉장히 낮다라는 편견을 많이 가지고 계시더라고요. 그래서 교수님한테 직접적으로 이제 유급률이라든가 이런 게 높냐라고 물어봤는데 국제학생들이 이제 약대 과정 따라갈 만하냐라고 물어봤는데 교수님 말로는 이제 코비드 이제 때는 한 80% 정도였는데 원래는 95에서 98% 정도 학생들이 다 1학년에 입학해서 4학년까지 끌고 간다라고 그러면은 유급률이 상당히 낮다라는 거를 아마 아실 수 있을 거예요. So yeah, we are running out of our time. So the next meeting, yeah, is away.
Yep.
So yeah, thank you for your presentation. Yeah.
Thank you so much, Leonie. That was so helpful. I'll just share with UK Ed Centre colleagues just the South Korean webpage, just where students can then go on to. You can see. So I'll share that with you, and then you've got that.
Yeah.
But thank you all so much.
Thank you.
Thank you very much. Enjoy the rest of your day.
Thank you.
Bye.
Bye bye.